What is biomedical waste management? So first, you need to know about what is biomedical waste. It refers to any waste generated during diagnosis, treatment, or immunization of humans or animals, research activities, production of testing or biological materials. And the biomedical waste is categorized into two conditions called general waste and hazardous waste. In general waste, it is mainly about 75 to 90 percentage of the waste, and hazardous waste includes 10 to 25 percentage of the waste. Okay, so in this condition, in general waste, there is non-hazardous waste like paper, plastics, any food waste that comprise of, as I spoke about, 75 to 90 percentage. Hazardous is infectious, pathological, radioactive, and chemical substances of 10 to 25 percentage. Who is at risk from biomedical waste? Healthcare workers, patients, the visitors who come to the healthcare facilities, general public as at risk if biomedical waste is not properly managed. Support personnel like cleaners, laundry workers, similar services. Waste management workers, why? Each bag has each coloration because you need to know what waste to put in each color because they would be handling it in so and so care for each packs. Those involved in waste treatment or management of disposal facilities. Transport staff, personnel transporting of biomedical waste. Health hazards of biomedical waste is basically it causes infections, chemical hazards, radiation exposure, and public sensitivity. Infections as hepatitis B or C due to sharps, contaminated materials. Chemical hazards due to toxic substances like formaldehyde or different substances. Radiation exposure from improperly disposed radioactive materials. Public sensitivity. Mismanagement can lead to community health issues and environmental contaminations. That's a major key factor of it. Categories which speak about in each color bag what all types of waste would it be containing. So type of waste will be human anatomical waste, animal anatomical waste, solid waste, and expired or discarded medicines or pharma. It comes under a yellow colored non-chlorinated plastic bags. And how it is treated? It is treated by incineration or the plasma, parasol, deep burial, different type of waste. Focus on the color and the contents of it. In category of red, it contains about tubing, IV bottles, catheters, urine bags, gloves, syringes. And type of bag is red colored non-chlorinated plastic bags or containers. It's treated by autoclaving, microwaving, hydroclaving, and different of followed by shredding. In white bags, it is the sharps, including needles, blades, scalpels, syringes. So white will have all these very sharp materials. Think it on such a point when you speak about sharp. Red is which is connected to how do you give a IV line. You can think like that, the tubing, the IV bottles. Okay, so the same way when you connect it with the connections of again the urinary catheter, urine bags, and what will do you help for it? The gloves, syringes. So just think about on such a way for the red. When you move to blue, glassware, broken, discarded, contaminated glasses, like when you will have this medicine vials and any metallic body implants. So it would be a bag which is puncture proof, leak proof box because it should not puncture as the sharp glasses there, so it can puncture it fast if it's a bag which can cause puncture and it may cause injuries as we saw. It may cause infection or it may cause injury to the biomedical waste handlers. And so, how do you treat this? By the disinfection through different materials, and that's how it's been getting it out. The whole gist of biomedical waste management. Segregation, how is it done? On what color? On what type of bags? The green waste shows about kitchen waste, paper tissues, water bottles and cans, which is by disposal, by incineration, and which goes to secure landfilling. In case of infected plastics, syringes, gloves, plastic waste, which has been done by autoclaving and it's also going to the secured landfilling. Now, when it comes to infected waste, it can be a solid one, can be an anatomical one, or maybe a chemical liquid, laboratory waste, expired, discarded. They are being used to treated by autoclaving, plasma pyrolysis, or incineration. And then it goes to deep burial. And at the same way, on the next point, when we speak about the glassware, again antibiotic vial, the metallic implants, glassware materials, except cytotoxic ones. Again, all these things, as I told about the broken ones, it should be in a treated on a perfect way, so it should wouldn't be a causing to any harm to or injury to the even the handlers. Autoclaving would be done and it would be sent to recycling. Next are sharps, needles, and cut glasses, which would be autoclaved and which would be sent to sharp pit. So all this would be treated under a common treatment facility. Thank you.